Imagine this, you're a man who's been experiencing consistent difficulties in achieving or maintaining an erection suitable for sexual activity. This isn't just a one-off situation, it's been happening persistently, and it's starting to affect your confidence and quality of life. This scenario, my friends, is a glimpse into the world of erectile dysfunction, often referred to as impotence. Erectile dysfunction is a common condition, with the National Institute of Diabetes, Digestive and Kidney Diseases reporting that approximately 30 million men in the United States alone experience it. However, this figure likely underestimates the true prevalence, as many men may not seek medical help or feel comfortable discussing it openly. What causes this condition? Well, it's typically a mix of physical, psychological factors. Physical causes can include underlying medical conditions like diabetes, heart disease, hormonal imbalances, or even the side effects of certain medications. On the psychological side, stress, anxiety, depression, and relationship issues can all play a part. It's important to note that not every man who has getting an erection has erectile dysfunction. Occasional difficulties can happen to anyone and are usually nothing to worry about. It's when the problem becomes persistent and recurring that it's diagnosed as erectile dysfunction. The impacts of this condition extend beyond the physical. Erectile dysfunction can lead to feelings of embarrassment, frustration, and a decrease in self-confidence. It can put a strain on relationships and even lead to mental health issues if not properly addressed. So, we've taken our steps into understanding erectile dysfunction, a journey that requires us to recognize its prevalence, its causes, and its impacts. It's a condition that can affect any man at any age, and it's nothing to be ashamed of. With understanding comes empowerment, and with empowerment comes the ability to take action. Now you have a basic understanding of what erectile dysfunction is and how it can affect an individual. Who is more prone to developing erectile dysfunction? Is it tied to age? These are questions that often linger in the minds of many, and today we're going to tackle them. Erectile dysfunction, or ED as we often refer to it, is a condition that doesn't discriminate based on age. It can affect men of all ages, from young adults to those in their twilight years. However, statistical data does suggest that the likelihood of developing ED increases with age. Why does this happen, you might ask? As men age, the risk factors associated with erectile dysfunction tend to become more prevalent. Conditions like cardiovascular diseases, diabetes, and hormonal imbalances that can contribute to ED are often more common in older adults. But the important thing to remember here is that correlation does not imply causation. Just because these risk factors and the incidence of ED both increase with age, it doesn't mean that getting older inevitably leads to erectile dysfunction. Think of it this way, age may be a risk factor, but it's not a determinative one. It's not a ticking time bomb that guarantees the onset of ED once you hit a certain age. Instead, it's one of many factors that, combined with others, can increase the likelihood of developing this condition. It's also crucial to remember that while the incidence of ED is higher in older men, it can and does affect younger men as well. Younger individuals might face ED due to psychological factors like stress and anxiety, or lifestyle factors like excessive alcohol consumption or drug abuse. So, while age can indeed influence the prevalence of erectile dysfunction, it's not a solitary deciding factor, nor is it a guaranteed outcome of getting older. A variety of other factors, both physical and psychological, play into the complex puzzle that is ED. So, while age can be a factor, erectile dysfunction is not a guaranteed part of aging and can affect younger men as well. Can lifestyle choices contribute to erectile dysfunction? A question that may have crossed your mind, and the answer is a resounding yes. Lifestyle choices play a significant role in the development of erectile dysfunction. A silent struggle that can impact a man's confidence, relationships, and overall quality of life. Let's delve deeper into this. First up is smoking. The toxins from cigarettes can damage blood vessels, impeding blood flow to the penis. This reduced blood flow can lead to difficulties in achieving or maintaining an erection. Quitting smoking, therefore, can be a powerful step in preventing or even reversing erectile dysfunction. Next, we have excessive alcohol consumption. While a glass of wine or a pint of beer may set a romantic mood, too much alcohol can dampen your performance. Alcohol is a depressant that can affect both your ability to achieve an erection and your sexual desire. Moderation is key here. Drug abuse is another lifestyle factor that can contribute to erectile dysfunction. Substance abuse, including the misuse of prescription drugs, can interfere with the normal function of the nervous system and circulation, leading to erectile dysfunction. Seeking help for substance abuse is crucial, not just for sexual health, but for overall well-being. Obesity is a significant risk factor for erectile dysfunction. Excess weight can lead to conditions like diabetes, high cholesterol, and high blood pressure, all of which can cause erectile dysfunction. Regular exercise and a balanced diet can help maintain a healthy weight and reduce the risk of erectile dysfunction. Lastly, sedentary habits or lack of physical activity can also contribute to the development of erectile dysfunction. Regular exercise helps improve blood flow, including to the penis, and can help prevent erectile dysfunction. As we have seen, your lifestyle choices can significantly impact your risk of developing erectile dysfunction. Making healthy choices can not only improve your sexual health, but also enhance your overall well-being. Remember, it's never too late to make positive changes. How do you know if you have erectile dysfunction? What does the test involve? These are questions that many men grapple with, often in silence. Diagnosing erectile dysfunction is a process that begins with recognizing and acknowledging the symptoms. These can include persistent trouble getting or keeping an erection, reduced sexual desire, or other sexual performance issues. The process of diagnosing erectile dysfunction involves a comprehensive evaluation of your symptoms, medical history, and a physical examination. Doctors typically ask about your sexual history to determine if your problems are due to erectile dysfunction or other sexual disorders. They may also inquire about your psychological well-being, as mental health issues can play a significant role in erectile dysfunction. A physical examination usually follows, which may involve assessing your blood pressure, examining your penis and testicles, and checking your nerves for sensation. This examination can help identify any underlying physical cause of erectile dysfunction. In some cases, doctors may also recommend additional tests to further evaluate your condition. These can include blood tests to check for signs of heart disease, diabetes, low testosterone levels, and other health conditions. Urine tests can also be useful in identifying underlying health conditions. In some instances, an ultrasound may be performed to evaluate blood flow to the penis and check for signs of arterial disorders. Another test that may be used is the nocturnal penile tumescence test, which involves using a device to measure the frequency and strength of nighttime erections. This can help determine whether your erectile dysfunction is related to physical or psychological factors. It's important to remember that erectile dysfunction is a common issue, and there's no need to feel embarrassed about seeking help. If you're experiencing symptoms, it's essential to consult with a healthcare professional. They can diagnose your condition, identify any underlying causes, and guide you toward effective treatment options. When it comes to this intimate aspect of life, silence isn't golden. Open dialogue and professional guidance are the first steps towards regaining control and reviving the spark. Remember, if you're experiencing symptoms, it's essential to seek medical advice to get a proper diagnosis. What can be done about erectile dysfunction? When should treatment start? These questions often linger in the minds of many. Thankfully, we're no longer in the dark ages, and numerous effective treatments are available for this condition. Firstly, it's important to remember that treatment should begin as soon as erectile dysfunction starts to impact your quality of life. Don't wait for the situation to worsen. It's not just about sex, it's about your overall well-being, your self-esteem, your relationships. Now let's dive into the sea of treatment options available. Typically, the treatment approach is tailored to each individual's specific needs, and it may involve lifestyle changes, medication, or even surgery in some cases. Lifestyle modifications often serve as the first line of treatment. This could involve regular exercise, a healthy diet, quitting smoking, moderating alcohol intake, and managing stress and anxiety. These changes can have a profound impact on your overall health and significantly improve erectile function. Medication is another common treatment option. Drugs like sildenafil, tadalafil, and vardenafil work by increasing blood flow to the penis, making erections easier to achieve and maintain. These medications are usually effective, but like all drugs, they can have side effects, and they're not suitable for everyone. For some men, vacuum erection devices or penile implants may be a suitable option. Vacuum devices work by drawing blood into the penis, while implants replace the spongy tissue inside the penis that fills with blood during an erection. Psychotherapy can also be incredibly beneficial, especially when erectile dysfunction is due to psychological factors like stress, anxiety, or relationship issues. A mental health professional can help you navigate these challenges and improve your sexual health. In some cases, testosterone replacement therapy may be recommended if low testosterone levels are contributing to the problem. As you can see, there are several treatment options available, and there's no need to suffer in silence. The first step is reaching out to a healthcare professional.
If you are enjoying our content, please give us a like and subscribe.